Right. So the areas of focus that I want us to talk about this evening, basically, it's not going too deep into it, but basically looking at the Tanzania mobile adoption, which will help us to actually give us an overview on whether this is the route that we really need to take, and just a little bit of apps briefing overview, and then look at the components of mobile health applications, and then look at the roadmap. And basically, finally, to the innovators and everybody who's here, is that it can be done. So, Tanzania mobile adoption. Basically, in Tanzania, we have 7 known mobile network operators. I mean, you have Airtel, Tigo, Vodacom, Sasatel, TTCL, Zantel, and I think in Sasatel, and Benson Online. So these contribute to a total number of 25.6 million as of December last year. Now, 25.6 million mobile phone subscribers in Tanzania make up something like just over 50% of the total population. Again, I'm saying just over 50% of the total population because we don't know yet how many we are as they're going to be censored this year, but we know we are about 44 million. Right. But no, not much of the people really, including myself, have actually downloaded mHealth app. How many of us actually have been able to download an mHealth app in Tanzania?
Created in Tanzania or?
No, just downloading it on your phone and use it. You have one. What app do you have?
It's an app that allows you to train on a daily basis and keeps track of how many calories you burn in a day.
Great. At least you have one person who has actually downloaded an mHealth app. But majority of us haven't. Now this might be a general overview because it appears that way. But basically most people haven't really gotten into mobile health applications. And by not doing that, basically it leaves the innovators to concentrate on only one area of the mobile health applications, which is actually relying more on where the gap is at the ministry and getting to actually initiate anything to do with exactly what the ministry wants. But again, you have things like mobile web. Again, it's much more just a rough overview, which basically this is going to create a lot of challenge to innovators. Mobile health application download. This year, around the world, we expect that we're going to have something like 44 million applications downloaded, network applications downloaded this year alone. And then looking at 4 years later, it's expected to be at 132 million applications downloaded all across the world. Again, where's the market value? Because this is where now innovators really come in, developers really come in and see the value for applications and go back to their lab and start working on them. In the year 2010, mobile application apps, especially for mHealth, were something like 120 million in the whole. But again, by 2016, the market value for the mobile applications around the world is expected to be over 400 million. Now, this is data that was found in December. So, the source was I'm going to give the name. It's the university, it's one university in America which actually did this, and this was the professor who came up with these figures from the market. I'll give the details as soon as we finish here. So basically, there's a lot of value in mobile phone or mHealth applications in general in the market. But then, where do we see that value in Tanzania? I mean, what is happening? Can we really here in Tanzania be able to capture that market as well? Of course we can. Because you guys as innovators here, you can develop an app in Tanzania, and that application you can sell it to the developed world, where they have majority of the people have smartphones and Android phones, and they can sell. But at the same time, how do you then capture the market here in Tanzania? If the market in Tanzania has more users of feature phones, where does it leave you as innovators in this market? Basically, it leaves you with very, I don't want to say very minimal options, but basically it now drives you to getting, to developing more of the web content, or web application, wireless application protocols, which are compatible to the feature phones, so that when anybody gets into the links, they can be able to get the content. But with time, that really doesn't give you enough edge into the market. But when you develop the applications, what do you really need to have in mind? Because anybody can sit anywhere and develop an application, because they feel that they can develop an application, they have an idea of developing that application. But you always have to have the end user in your mind. And this is where now it comes for you to start thinking about the healthcare consumers. This is where you now need to consider about the Ministry of Health. This is where now you have to consider about an application that you don't really need to channel it through the Ministry of Health, where you can channel it to the market, but you need to do your good research. Are the people really going to love this? You know? And again, you come back to asking yourself, why do you normally download the application to start with your phone? So you start asking yourself those questions. I mean, one of the things is the context, basically, where you know that you can download any application and use it anywhere you want, without really having to struggle getting access. But then, most of these applications as well, what is the immediacy of that application? Our friend there is using a different application, but he saw the immediacy of actually using that application. Someone else will need to use something to do with diabetes. Someone else will need something to do with asthmatics, and so on. So the immediacy, why do you need it? Do you really need it now? Do the consumers really need this now? So that, with that in mind, it will actually be able to drive you well into deciding which application to actually develop.
Can I ask a question, sorry?
Yeah.
Do you reckon that there are enough interesting problems in mHealth that warrant people to solve? I mean, when you think about it, you can create any kind of application, but what problem is it going to solve? And even if a problem is there that can be solved, is it something that people will pay for? So, for example, the calorie thing, tracking your weight and everything else, it's nice to have, but am I going to pay for it?
Exactly.
And if I'm not going to pay for it, then is there really a business developing mobile applications for mHealth?
Exactly. That's why I say when you develop it, you have to have the issue about immediacy. I mean, does someone really need it now? Has the Tanzanian community really gone that step further, saying that, you know what, we all need this thing to do with calories? I know there are a lot of people who are doing some kind of SMS content to do with cutting the weight and taking care of health. I'm not quite sure how many of you have ever received that, but I've received a couple of them coming to me with some funny numbers, and they all come in English, and they seem to be coming normal when they're sent. They're sent in the same day, 4 contents consecutively. Do exercise, do this, do that, which means someone somewhere must be paying for that. Not quite sure whether it's going to be a specific organization or whatever, but somebody somewhere is doing that, because I'm receiving the content for free, but it's meant to help me. Again, this is like an mHealth application. And I remember one day I received one, and actually I thought about it, because I realized that I work long hours, I don't get time for exercises, and that application, that message that came into my phone actually reminded me, like, hey, you need to set aside a certain minutes per day to do exercises. Now, what exactly do we look into the components of mHealth? There can be so many components in the mHealth applications, but we have some of which are very common in the mHealth. One of it is that mHealth applications need to be educative, raising awareness. Again, You need an application that will connect people to a certain environment, connecting them to certain initiative. Again, most of these applications that are developed, they also aim at data collection. Now, this is another arena that most innovators can look into. Push Mobile, we've actually developed an application called mData. mData is actually meant to do data collection. You can customize it for any kind of an organization. And all you have to do is study the organization needs, customize it. It's a dashboard-based, SMS-based, but it can work effectively with USSD. Again, mHealth applications, they are meant to remind people. Pretty much soon, we're going to have the kind of a mother-child initiative going on. Again, what is it meant to do? It is meant to remind the mothers, once they register to the program, to remind them of taking different initiatives to look after themselves when they're pregnant, and then to look after their children once they're born, and to nurture them to a certain level of age, say up to two years or so. But again, someone also signing up to something like a diabetes application. Again, it is meant also to remind you on how to look after yourself day in, day out. So really, in 4 sentences, I can say the components of mHealth applications really, they're meant to be educative, they're meant to connect somebody, they're meant to collect data, and they're meant to provide reminder to people.
Have you considered, I'm sure you've been to Muhimbili Hospital, and you've seen how insane it is over there. Now, one very obvious application is scheduling appointments with the doctor. I've seen people who are sick go to the hospital, schedule an appointment, go back, and then come see the doctor again. Now, somebody as big as Push, obviously these ideas are things that people might have had already. But as an individual, trying to walk into Muhimbili Hospital and saying, look, I've got this application that will help people schedule appointments, it's not something that is easy to do. But as Push, have you guys tried to look at that and see if you could give people a way to tell the doctor that they're going to come and they have a certain problem and then be scheduled to visit them instead of having to go there and queue up and set it up? Because that would really change the lives of people.
Actually, we thought about that one. But while we thought about it, certain organization came in, certain people came in, some people from the University of Dar es Salaam, they're championing this. Of course, I won't say the names, but they're actually working on this particular application. And more likely we'll champion it with them by Push offering them connectivities. Basically, it's a hospital app. We call it hospital application for booking appointments, for sending reminders for people, like you have an appointment tomorrow, so make sure they're on time. But also, it's an application which can also be a query one, where you can actually query to find out whether a particular doctor at a certain hospital, when he is there on the shift, and stuff like that. So yes, we've considered that. But you see, here's the thing. Just the kind of things that I really enjoy, because you know what? People need to do brainstorming day in, day out. I mean, one of the members of the hub here developed one application that Push is actually pushing it in the market, and it has already, at its peak, it had something like 30,000 subscribers who were receiving daily content from that application. Again, this guy was a graduate of University of Dar es Salaam, and I'm pretty much sure that most of the developers and the innovators in here have different ideas. And you can come with your ideas, and we can see how we can actually connect you to this. Now, what's the roadmap really for developing these mHealth applications? As I said before, you really need to identify what is it that you want to sell to the market. You see, even if you develop something for the Ministry of Health, you will still sell it. At some point, they'll have to pay you for it. However, if you want to develop something with the Ministry of Health on your side, as Nzeru put it before, you need to go and see them. Understand what is their strategy. Understand where they are. Understand what is it that you can do that no one else is doing it with them. And then you have to be able to collect feedback from people, especially if you are championing an application which you actually plan to put it on the shelf and people out there to buy it. You need to do a lot of research. You need to do a lot of research in the market. You need to see, to exactly establish the gap and even work out whether this application, people will love it when they front it to the market. Again, the issues of culture is all which need to come in. And after that, I just want to tell you, the innovators, one thing, that you can do it. If other people have done it, you can do it. And what's the secret about doing it? You need to do a very clear research and development strategy. You need to have a very good innovative ideas. And of course, you need to have the technical know-how. This is where your expertise from the university or the college comes in. And out of all those, will lead you to developing a very good competitive mHealth application. Thank you very much. I welcome some